Om Swastiastu. Hello, we're from SGD B1, and in this opportunity, we're about to present our student project about immunomodulators. Next. This is our team members. Next. Alright, my name is Chakra-Sintan Lamskawati with 3-digit of student number 231. So the immune system is a network of cells, tissues, and organs that working together to defend our body against the foreign invaders. It's all because human body provides an ideal environment for infectious organisms such as bacteria, virus, parasite, fungi, and many other microbes. So in the healthy immune system, it's about the ability to distinguish between our own cells and foreign cells. But in abnormal situations, it may mislead our immune system to attack our own cells, and it's called autoimmune disease. Next. So as you can see, the immune system is incredibly complex. So when foreign invaders break in, there are two types of immune system may occur. The first one is a non-specific one. It's called innate immune systems. You can see the cells that plays roles in it in the picture. And next is the specific one. It's called adaptive immune systems. And as you can see from the pictures, there's T and B lymphocytes that plays roles in it. Next.
Hello, my name is Putri Agnes Monica with 3 last number student 100, and I will explain about the autoimmune disease and also immunomodulator in general. So first, autoimmune disease is caused by failure or self-tolerance and subsequent immune response against self or autologous antigens. And in the other side, environmental triggers like inflammation or inflammatory stimuli can promote the entry of lymphocyte into the network, activation lymphocyte, and also tissue injury. And until now, no one knows the etiology of autoimmune disease, but a number of factors such as virus, certain drugs, sunlight, and all of which may damage or alter normal cells of the body. And hormones and heredity also have role in autoimmune. Therefore, to treat autoimmune disease, immunomodulatory drugs are recommended because immunomodulators are able to modulate the body's immune system become normal. And there are 3 types of immunomodulators. First is immunostimulant. Immunostimulant is repair the function of our body's immune system, while immunosuppressor is the second, is to suppress the body's immune response, and also the last is immunorestorator, is to restore impaired body's immune function. Thank you.
Good afternoon, my name is Beatrice Agung Saraswati, number 152. So based on the description above, the problem can be formulated as follows. 1. What is the definition of immunomodulator? 2. How is the mechanism of immunomodulators? 3. What is the classification of immunomodulators? 4. What are the roles of immunomodulators in HIV? And 5. What are the roles of immunomodulators in malnutrition? The purpose of this paper is to explain the definition, mechanism, classification of immunomodulators, also the roles of immunomodulators in HIV and malnutrition. After comprehending this paper, medical students will be able to know about the definition, mechanism, classification of immunomodulators, and also the roles of immunomodulators in HIV and malnutrition.
My name is Rosa Benujin Priyatna with student number 115. So the immune system function is to prevent or eradicate infections, and the organ of immune system are placed throughout the body as it shows in the pictures, and the lymphatic system allows the immune cells to travel between tissues and the bloodstream. For the mechanism itself, it can be activated by a lot of different things that the body doesn't recognize, and if this can get through the body frontline defenses, the innate immune system will take place. And this will initiate the adaptive immune system so that it will produce the antibody. When there is something wrong in the system, it is called as immune disorder. Overactivity of the immune system is related to disorders such as allergies and autoimmune disease. When the immune system is missing, the result is related to immunodeficiency disorder, and this can be helped by immunomodulator. So, immunomodulator is a medication that modifies the immune response or the functioning of the immune system. And the immunomodulators can act as immunosuppressant and immunostimulant.
Good afternoon. My name is Claudia. I'm number 58, and now I will explain about the immunosuppressive agent, which have the main function to suppress the immune system. Each of these agents have a different mechanism of action. The first class is the calcineurin inhibitor. It inhibits the work of the calcineurin in inhibiting the T cells which have the immunity function. The second class is interleukin inhibitor, which inhibit the work of the interleukin. It has the function in regulating the cytokine in the immune response. The third class is the selective immunosuppressant. It has a selective a point of action, and it is often used in the cases such as the disease of the immune, or when you want to transplant the organ and such and so on. And the fourth one is the TNF alpha inhibitor. It is often used to suppress the body's natural immune response to the TNF.
Hello, my name is Bagus Indra Nagastia with last 3-digit standard number 032. Chemical stressor drug or action that raises the innate or non-specific immune response by interacting directly with cells of the immune system and activating them is called as immunostimulant. Because there is no memory element, the effect is possible to be of short duration. Specific immunostimulants such as vaccine affect an immune response to specific antigenic types. Non-specific immunostimulants do not have antigenic specifically and are widely used in immunodeficiency, chronic infection, neoplastic disease, and autoimmunity. Class of immunostimulant contain colony-stimulating factor, bacterial vaccine, interleukin, interferon, vaccine combination, viral vaccine, and therapeutic vaccine. Immunostimulants that do not suit into this category are classified as other immunostimulants. Thank you.
Alright, now I'm going to explain about the mechanism of action of immunosuppression and immunostimulant. The first one is the immunosuppression. The exact mechanism of action of immunosuppressive drug is a challenge to explain, partly because of the physiological of immune response has not been completely understood yet. So there are four major classifications of immunosuppressants, namely calcineurin inhibitors, anti-proliferative drugs, glucocorticoids, and antibodies. So I'm going to explain the first two ones. The first one is calcineurin inhibitors. Calcineurin drugs includes cyclosporin and tacrolimus. These two drugs enter the cytoplasm and binds to the receptor. Cyclosporin binds to the CPN and tacrolimus binds to the FKBP receptors. These two complexes will then cause the inhibition of calcineurin. As a consequence, the nuclear factor is inhibited, and transcription and translation of EL2 is also inhibited. The second one is an anti-proliferative drug. As its name applies, anti-proliferative. It prevents the proliferation of T lymphocytes and B lymphocytes. It is usually used in treating carcinomas. Some of these drugs include azithromycin, cyclophosphamide, methotrexate, chlorambucil, mycophenolate, and mofetil.
My name is Christian Bastiantalo, number 075. Next one, we have glucocorticoid. Glucocorticoid induce apoptosis, inhibit T cell proliferation and T cell dependent immunity, and also downregulation of cytokine synthesis and produce anti-inflammatory effects. And the last one, we have antibody. Some of the developed antibodies implemented are anti-lymphocytic antibody, immunoglobulin 4, hyperimmunity immunoglobulin monoclonal antibody, and resuscitate immunoglobulin microdose. Antibodies bind specifically to T cell helper and prevent their response and deplete them. Thank you.
Hello, my name is Timothy Alcurnia with Team 006, so now I'm going to explain about the immunostimulant mechanism of action. So immunostimulant can be classified into two classes. The first one is specific and the second one is the non-specific immunostimulants. So specific immunostimulants provide antigenic specificity in immune response such as vaccine or any antigens. On the other hand, the non-specific immunostimulants can helps by augmenting immune response of other antigens to stimulate components of the immune system without antigenic specificity, such as adjuvant and non-specific immunostimulators, and some of which are medical herbs. And there are many substances that can act as immunostimulants, and one of which are imiquimods, where imiquimods have two ways of action. The first one is the direct action, where imiquimods can initiate the caspase family of proteases, and then it will activate the pro-apoptotic molecule such as apoptosis inducing factor, HTRA2, cytochrome C, and endonuclease G, and then it will actually stimulate caspase 9 and BCL2 that will help distracting the malignant cells. And the second one is the indirect actions, where imiquimod release various cytokines such as interleukin 12, tumor necrosis factor alpha, and interferon G, and these will raise the level of cytotoxic T cells and natural killer cells, and it will help blocking the angiogenesis of the cells. And furthermore, it can also stimulate the anti-tumor cells. Thank you.
I'm Vicky Samantha with student number 079. The role of immunomodulator in HIV. HIV-1 activates an uncontrollable inflammatory response of immune components, like inflammasomes. Immunotherapy is being considered as a method to eliminate latent HIV-1 reservoir in CD4 plus T cells. Some immunomodulatory agents could help improve HIV prognosis. The first one is type 1 interferon. It is an antiviral suppressor of HIV-1 replication used to create persistence in acute stages of the infection. CD4 plus T cells sense HIV-1 infection by the cytosolic DNA sensor, CGAS, and stimulate the production of interferon. Another one is sulfasalazine, an anti-inflammatory agent that inhibits inflammasomes when combined with antibiotic sulfapyridine and 5-aminosalicylic acid. It also alters an FKB signaling pathway and inhibits pro-inflammatory genes expression, thus decreasing the release of interleukin-1 beta. The activity of these inflammasomes may suggest that sulfasalazine is capable in regulating inflammatory response when induced by different stimuli, including HIV.
Hello, my name is Yudi Harawati with last three student number 175. As you know, nutrition plays a major role in treating a disease not only in acute but also chronic. Further nutrition such as macronutrients and micronutrients are associated in enhancing the body's immune response to pathogens. In malnutrition can cause a deficiencies of macro and micronutrients, which can lead into the immune deficiencies in both innate and adaptive immune responses and can rise in individual suspicions of developing a disease. Therefore, malnutrition requires a lot of immunostimulants to treat immunosuppressive. A study shows that providing macro and micronutritional supplements may help in monitoring the patient body weight, BMI, and increasing the function of T cells in the immune system. As well as in the viral host responses, micronutrients can help in resisting and work more synergetically in the treatment of the viral infection, both in the activity of innate and adaptive immunity as well. Recent studies show micronutrients may help to manage the immunity of COVID-19 patients. A part of micronutrients, a study conducted on mice showed that pomegranate skin polysaccharide can be used as an effective immunostimulant in chemotherapy-induced immunosuppression, as well as for food and pharmaceutical industries.
Hello everyone, my name is Naraswara Pausi, student number 135. So I would like to tell you the conclusions of our student project. So, human immune system has a unique characteristic that we call it as self-tolerance. This self-tolerance is going to help the immune system to differentiate between our cell and the antigens. When the ability lost, we're going to develop a disease that we call it as autoimmune. To treat this disease, we need immunomodulators. Immunomodulators can help the immune system to gain back their function. Immunomodulators is divided into two, immunosuppressants and immunostimulants. In immunosuppressant, they classified into calcineurin inhibitors, antiproliferative drugs or cytotoxic drugs, glucocorticoids, and antibodies. For the immunostimulants, they get divided into specific immunostimulants and also non-specific immunostimulants. In human immunodeficiency virus or HIV, immunomodulators can help to control the uncontrollable inflammatory, while in a malnutrition, they're going to help the body to maintain back their immune functions. So that's all our student project presentations. Thank you.